Typically, a hippotherapy session will last as long as 30 minutes. Usually it doesn't exceed 30 minutes. Typically a patient has to work up to go into 30 minutes. It's not so easy as it looks. Caden can tell you too, because he started and he wasn't on as long. Now he stays on a lot longer, and he's a very, very good rider. This is Blue. He's one of our therapy horses. He's 18 years old. He's a registered quarter horse. Blue is kind of famous around these parts. He carried the American flag in the 2004 Olympic trials that they had in Del Mar. The difference between therapeutic riding and hippotherapy is in hippotherapy, the horse is influencing the person. In other riding, regular riding, therapeutic riding, the person influences the horses. They make them go left, they make them go right, they make them stop. Here, I am not interested in teaching anybody how to ride. What I am interested in is the horse producing what I want so that the patient will have a certain motor function or sensory or whatever I want. So really the horse influences the patient, not the other way around. And that's typically what we're taught riding is, kick them, stop them, go. Not so much here. Everybody must wear a helmet and must wear a gait belt, whether they're 2 years old or 200 years old. It's for their safety. Now they're standing there because we want the horse to be lined up, and Blue does it wonderfully. I'm going to ask, he's going to stay here until I ask him to get on, then he'll get on. Now, Josh can get on by himself so he doesn't need assistance. And now we're going to make sure everything is copacetic. Is he okay? Is I okay? And usually if we have enough volunteers, someone in the back to make sure they're adjusted, and he seems to be perfect. Good? Okay. And then the therapist typically will tell the horse handler what to do, and we say, okay, go ahead, walk him out a few steps. Give me time to jump off. And now, what we'll do also, what we'll also do is, like Blue has a nice four beat walk. He's done. That's what we're kind of looking for, that movement. If we ask Lorraine to lengthen him out, we're going to get a whole different gait. Him going faster and lengthening out really a lot up that way. Without getting into a trot, he's really, as you can see, Blue is really moving a different way. It's very subtle. However, with, picture if you had a disability or you have weakness or you're not real secure in your seat, it makes a huge difference. And then we're going to do some figure eights. Right? As the horse is doing a figure eight, he's going to be turning his body, which is shortening on this side and lengthening on this side. Well, again, a lot of people say if they have strokes or different types of that, I might want that lengthening on one side. I might want them to lean this way and that. So you would, like I said, I would do what I want to do on the horse to elicit that response on the patient. The thing about a horse is it has a multi-dimensional movement. Their pelvis and spine move just almost exactly in the same ratio as a human pelvis on a spine. So what happens, and that's why people feel like, oh my God, it's walking, because once they get into that rhythm, that spinal pelvic movement is it's almost identical to ours. We can't duplicate it in the clinic. They've tried to make barrel horses in the clinic and try to reproduce it, and it's never been successful. The other thing is, it's tactile, it's sensory, it's motor, it's balance, it's coordination. There's so many things going on here. There's movement in space, vestibular, he's got to see, he's looking. So there's so many senses going on here at one time that it's exhausting. I've had patients stay on the first time for 7 minutes and then sleep the afternoon away because it was exhausting. So many children or many adults can't cross their midline and can't twist and disassociate the trunk from, they do everything kind of like that. So, all right, now reach over. have him reach over with his right and do rings. And again, he's on the horse, it's fun. Sometimes we put the rings on the horse. We also have little twisties we put in their manes, and we do many other different things. What? Jedi wants to go backwards. That's what I'm going to have him go backwards. Thank you, Jedi. Yeah, we're going to have him go backwards now. We do that a lot of times. Many reasons, and let's walk out. Now, he's got these as a whole different muscle groups you're using now to keep yourself up. If we need that input in the shoulders and to put down, we have a little girl, developmentally delayed, and she, putting pressure through her shoulders and holding herself up is she loves doing it on blue. She loves it. It's fun. And then when she gets tired, she puts her head down, and then she can get herself up. And just postural, there's a whole lot of stuff going on here that, now, Josh is a healthy little 8-year-old kid, but you've got anybody with some type of disability. I've ridden backwards first because I would never do anything to a patient that I never did. Whoa, it was. This is what we do. It doesn't, although it looks like a nice little pony ride, it really isn't. It's really a lot of work. Any of our patients that are here today can tell you it's a lot of work. So, and I give kudos to anybody who has enough nerve to get up there. It's not so easy. We're going to bring him here and have him dismount.